Meet the hero of our story. Let's call him Carlos, 38 years old, married, father of 2 children, successful professional. But there's something bothering him. Sometimes, when the moment of intimacy arrives, he feels that his erection takes longer to happen, or disappears quickly, or that the firmness isn't like it used to be. He ignores it, thinks it'll pass, or blames stress. But the problem continues silently and is settling in. These are the silent signs of erectile dysfunction, and many men don't talk about them because they feel ashamed or believe it's normal with age. In this video, we're going to explore 5 signs that indicate you may already be at the beginning of erectile dysfunction and why it's important to act before it's too late. We're going to show you what less firm erection or shorter duration means, and why this might not just be tiredness. We'll talk about how to notice changes in sexual desire or arousal, which often accompany erectile dysfunction. We'll explore the relationship between poor sleep, abdominal obesity, high blood pressure, diabetes, and erection. In other words, the silent era of risk factors. We'll explain why erectile dysfunction can be indicative of broader cardiovascular or vascular problems, since the vessels of the penis share mechanisms with those of the heart. And we'll cover what to do immediately. Simple self-assessment, when to seek a professional, which tests to request, how nutrition, exercise, and sleep fit into this equation. Carlos feels vulnerable, fears losing intimate contact with his partner, feels less of a man than before, and fears the future. But there is hope. By showing him that he is not alone, that there are strategies and interventions that can reverse or minimize the damage, we're going to give him and you a 3-step plan for quick reaction. For example, assess and screen, initiate lifestyle change, seek specialized support if necessary. And at the end, I want you to comment, what is your biggest pain point right now regarding your sexual health? What worries you most or prevents you from living your intimacy to the fullest? Share, so that together we can bring more clarity. Let's start with understanding what's really happening when these signs appear. Carlos represents millions of men worldwide who are experiencing the early warning signals of erectile dysfunction but are too embarrassed or confused to address them. The truth is that erectile dysfunction isn't just about what happens in the bedroom. It's a window into your overall health, a canary in the coal mine that can alert you to serious underlying conditions before they become life-threatening. When we talk about erectile dysfunction, we're not just talking about an inability to achieve or maintain an erection sufficient for sexual intercourse. We're talking about a spectrum of changes that can be subtle at first but progressive over time. And here's the critical point. The earlier you recognize these signs, the more effectively you can intervene, potentially reversing the condition entirely or at least preventing it from worsening. So what are these 5 silent signs that you need to watch for? The first sign is what we call reduced erectile firmness. You might notice that your erections aren't as hard as they used to be. Maybe you can still achieve penetration. Maybe you can still complete sexual intercourse, but there's a noticeable difference in rigidity. On a scale where 10 represents the firmness you had in your 20s, that rock-hard, could hang a towel on it erection, you might now be at a 7 or 8. This might seem like a minor change, something you can live with, but it's actually an important warning sign. The penis requires robust blood flow to achieve maximum rigidity. And when that blood flow is compromised even slightly, firmness decreases. This compromise in blood flow doesn't happen in isolation. It reflects changes in your vascular system overall. The same processes that reduce blood flow to the penis, atherosclerosis, endothelial dysfunction, inflammation, are also affecting blood flow throughout your body, including to your heart and brain. So that slightly softer erection isn't just about sexual performance. It's potentially an early indicator of cardiovascular disease, sometimes appearing 3 to 5 years before a cardiac event. This is why cardiologists and urologists increasingly view erectile dysfunction as a cardiovascular risk marker, not just a sexual problem. The second sign to watch for is decreased duration of erections. Maybe you can achieve a full, firm erection initially, but you notice it doesn't last as long as it used to. Perhaps you lose your erection during foreplay, or during the time it takes to put on a condom, or during position changes, or before you've reached climax. This inconsistency can be frustrating and anxiety-provoking, and unfortunately, that anxiety can create a vicious cycle, making the problem worse. But let's look at the physiology. Maintaining an erection requires continuous signals from your nervous system and sustained blood flow to the erectile tissue. If you're losing erections prematurely, it could indicate that the smooth muscle in the blood vessels of your penis isn't staying relaxed, or that blood is leaking out of the erectile chambers too quickly due to venous leak, or that the nervous system signals are being interrupted. Common causes include declining testosterone levels, neurological issues, including those related to diabetes, psychological factors like performance anxiety or relationship stress, side effects from medications like antidepressants or blood pressure drugs, or again, those underlying vascular problems. The important thing to understand is that erections that come and go unpredictably are telling you something. Your body is struggling to maintain the complex orchestration of hormones, nerves, and blood vessels required for sustained erectile function. The third sign is reduced sexual desire or libido. Now, you might be thinking, wait, isn't that different from erectile dysfunction? Yes and no. While erectile dysfunction specifically refers to the physical ability to achieve and maintain erection, it often travels with changes in libido. And the two can reinforce each other if you notice that you're just not thinking about sex as much as you used to, that you're not initiating intimacy with your partner, that you feel indifferent when opportunities for sex arise, or that you have to work harder mentally to get aroused. These are important signs. Low libido can stem from declining testosterone, which naturally decreases with age but can drop more dramatically due to obesity, metabolic syndrome, chronic stress, poor sleep, or certain medical conditions. It can also result from depression, relationship problems, chronic stress and burnout, or side effects of medications. Here's the critical connection. Low testosterone doesn't just affect desire, it also affects erectile function directly. Since testosterone plays a role in the nitric oxide pathway that's essential for erections. Additionally, when you're not interested in sex, you're less likely to have erections, and the use it or lose it principle applies. Regular erections, including nighttime erections, help maintain the health of erectile tissue by providing oxygenated blood. When erections become infrequent, the tissue can undergo changes that make future erections more difficult. So if you're noticing changes in your desire for sex, don't dismiss it as just getting older or being too busy. It might be an early warning sign that needs attention. The fourth sign, and this is the one that many men completely overlook, is the presence of risk factors that damage your vascular and metabolic health. These include poor sleep quality or sleep disorders like sleep apnea, abdominal obesity, particularly that belly fat that accumulates around your organs, high blood pressure, even if it's being treated with medication, prediabetes or diabetes, high cholesterol, smoking, excessive alcohol consumption, and sedentary lifestyle. Why am I calling these signs of erectile dysfunction? Because these conditions don't just increase your risk of erectile dysfunction in some abstract future. They are actively damaging the mechanisms of erection right now, even if you haven't noticed symptoms yet. Let's look at each one briefly. Poor sleep and sleep apnea disrupt hormone production, particularly testosterone, and also increase inflammation and stress on your cardiovascular system. Abdominal obesity is not just excess weight. It's metabolically active tissue that produces inflammatory compounds and disrupts hormone balance, converting testosterone to estrogen and creating insulin resistance. High blood pressure damages the delicate lining of blood vessels, the endothelium, which is responsible for producing nitric oxide, the molecule that allows blood vessels to relax and fill the penis with blood. Diabetes damages both blood vessels and nerves, a double hit to erectile function. High cholesterol leads to atherosclerosis, narrowing the small arteries that supply the penis. Smoking damages blood vessels and reduces nitric oxide availability. Excessive alcohol impairs nervous system function and reduces testosterone. A sedentary lifestyle reduces cardiovascular fitness and contributes to all the other risk factors. If you have 2 or more of these risk factors, you're in what I call the silent era of erectile dysfunction. You may not have obvious symptoms yet, but the damage is accumulating, and it's only a matter of time before it manifests as noticeable erectile problems. The good news is that this is also the window of opportunity where intervention is most effective. The 5th sign is morning erections becoming less frequent or absent. Most men don't realize that healthy males typically have 3 to 5 erections during sleep, associated with REM sleep cycles. These nocturnal and morning erections serve an important physiological function. They bring oxygen-rich blood to the erectile tissue, keeping it healthy. Morning erections, sometimes called morning wood, are often taken for granted until they disappear. If you notice that you're waking up with erections less frequently, or that your morning erections are less firm, this is significant. The presence of morning erections generally indicates that the physical plumbing, the vascular and neurological systems, is working properly, which means erectile problems during sexual activity are more likely psychological. But when morning erections diminish or disappear, it usually indicates a physical problem with the erectile mechanism itself. This could be vascular disease, neurological problems, hormonal imbalances, particularly low testosterone, or side effects from medications. The disappearance of morning erections is often gradual, so you might not notice the change until you think back and realize it's been weeks or months since you had one. This is why it's worth paying attention to. It's one of the most reliable indicators of your erectile health status. Now, let's talk about why all of this matters beyond just sexual performance. Carlos is worried about his relationship, his identity as a man, his confidence. These are valid concerns, and they're important. Sexual intimacy is a crucial component of romantic relationships for most couples, and problems in this area can create distance, resentment, and communication breakdowns. Carlos might start avoiding intimacy to avoid the embarrassment of erectile difficulties, which can make his partner feel rejected or unattractive. He might feel that his masculinity is diminished, struggling with feelings of inadequacy. These psychological impacts are real and significant. But there's an even more urgent reason to pay attention to these signs: your cardiovascular health and your life. Research has consistently shown that erectile dysfunction is an early warning sign of cardiovascular disease. The arteries that supply the penis are smaller than those that supply the heart, so they become narrowed by atherosclerosis earlier. This means erectile dysfunction often appears years before a heart attack or stroke. In fact, men with erectile dysfunction have a significantly elevated risk of major cardiac events in the following years. Erectile dysfunction is also associated with increased risk of diabetes, metabolic syndrome, and overall mortality. Think of erectile dysfunction as your body's way of telling you that something is wrong with your vascular system before it becomes catastrophic. This is why addressing erectile dysfunction isn't vanity. It's preventive medicine. So, what should Carlos do? What should you do if you recognize any of these 5 signs? Let me give you a practical 3-step action plan. Step 1 is assess and screen. Start with honest self-assessment. Track your erectile function for a few weeks. Notice the firmness of your erections on a scale of 1 to 10. Note how long they last. Pay attention to morning erections. Consider your libido and desire. Think about when problems occur. Is it only with your partner or also during masturbation? Is it situational or consistent? This information will be valuable. Next, evaluate your risk factors. Do you have abdominal obesity? Measure your waist circumference. For men, greater than 40 inches is a significant risk factor. Do you have high blood pressure? When was the last time you checked? Do you snore loudly, or have you been told you stop breathing during sleep? Do you have diabetes or prediabetes? High cholesterol? Do you smoke? How much do you exercise? How's your sleep quality? How's your stress level? Be honest with yourself about all of these factors. Finally, consider taking a validated questionnaire like the International Index of Erectile Function, which you can find online, to give you a baseline score of your erectile function. Step 2 is initiate lifestyle changes immediately. You don't need to wait for a doctor's appointment to start making changes that can improve your erectile function. These changes address the root causes and can have remarkably rapid effects. First, improve your diet. Focus on a Mediterranean-style diet rich in fruits, vegetables, whole grains, fish, olive oil, and nuts. This eating pattern has been shown to improve erectile function by reducing inflammation, improving endothelial function, and supporting cardiovascular health. Reduce processed foods, excessive sugar, and unhealthy fats. Second, start exercising regularly. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week. Brisk walking, jogging, cycling, swimming. Add resistance training 2 to 3 times per week. Exercise improves cardiovascular fitness, helps with weight loss, reduces stress, improves insulin sensitivity, and can boost testosterone. Studies show that regular exercise can significantly improve erectile function, sometimes as effectively as medication for mild to moderate cases. Third, prioritize sleep. Aim for 7 to 9 hours of quality sleep per night. If you snore heavily or have symptoms of sleep apnea, get evaluated. Treating sleep apnea can dramatically improve erectile function. Fourth, reduce alcohol and quit smoking. Both have direct negative effects on erectile function, and the benefits of quitting start almost immediately. Fifth, manage stress. Chronic stress elevates cortisol, which suppresses testosterone and creates a state of sympathetic nervous system dominance that interferes with erection. Find stress management techniques that work for you: meditation, yoga, therapy, hobbies, time in nature, whatever helps you decompress. Sixth, consider your medications. If you're taking medications for depression, anxiety, high blood pressure, or other conditions, and you've noticed erectile changes since starting them, talk to your doctor about alternatives. Don't stop medications without medical guidance, but know that there are often options that have less sexual side effects. Step 3 is seek professional support appropriately. If you've made lifestyle changes and aren't seeing improvement within 2 to 3 months, or if your symptoms are moderate to severe, or if you have significant risk factors like diabetes or cardiovascular disease, it's time to see a healthcare provider. Start with your primary care doctor, or seek out a urologist or men's health specialist. What will they do? First, they'll take a detailed history, asking about your symptoms, their onset, associated factors, medical conditions, medications, lifestyle, and relationship issues. Be honest and thorough. This information guides diagnosis and treatment. Second, they'll perform a physical examination, checking for signs of hormonal problems, cardiovascular issues, and genital abnormalities. Third, they'll order laboratory tests. At minimum, this should include fasting glucose and hemoglobin A1C to screen for diabetes, lipid panel, to check cholesterol, testosterone level, preferably measured in the morning when it's highest. Depending on your situation, they might also check prolactin, thyroid function, PSA for prostate health, and other hormones. Fourth, they might perform or refer you for additional testing like nocturnal penile tumescence testing to check if you have erections during sleep, vascular studies to assess blood flow to the penis, or psychological assessment if there's a significant psychological component. Based on these findings, your doctor can recommend treatment options. These might include continuing and intensifying lifestyle modifications, treating underlying conditions like diabetes, high blood pressure or low testosterone, counseling or sex therapy. If there are psychological or relationship factors, medications like PDE5 inhibitors such as sildenafil, also known as Viagra, tadalafil, also known as Cialis, or others, vacuum erection devices, penile injections, or, in severe cases that don't respond to other treatments, penile implants. The important thing is that there are many effective options, and the right approach depends on your specific situation. Let's return to Carlos for a moment. When Carlos finally acknowledged his problem and took action, here's what happened. He started by tracking his symptoms and realized the pattern had been developing for over a year. He assessed his risk factors and confronted some uncomfortable truths. He'd gained 30 pounds over the past 5 years, mostly around his middle. He was barely exercising. He was sleeping poorly due to work stress, and his diet consisted largely of fast food and takeout. He decided to make changes before seeing a doctor. He started walking every morning before work, gradually building up to jogging. He and his wife started cooking healthier meals together, which actually improved their relationship and communication. He set a firm bedtime and created a sleep routine. Within 6 weeks, He'd lost 12 pounds, was sleeping better, and noticed his morning erections returning. His erections during intimacy improved in firmness and duration. But he also scheduled an appointment with his doctor, who ran blood tests and discovered Carlos had prediabetes and low testosterone. With this information, Carlos was able to work with his doctor on a comprehensive plan that included continuing his lifestyle changes, considering testosterone replacement, and having medication options available if needed. Importantly, Carlos opened up to his wife about what he'd been experiencing, and her support and understanding removed a huge psychological burden. 6 months later, Carlos reports that his erectile function is better than it's been in years. His overall health has improved dramatically, and he feels he may have dodged a bullet in terms of future heart disease. The story of Carlos illustrates several crucial points. First, erectile dysfunction is often multifactorial. It's rarely just one cause, but rather a combination of vascular, hormonal, neurological, and psychological factors. Second, lifestyle factors play a massive role, and lifestyle changes can be remarkably effective, sometimes reversing erectile dysfunction entirely. Third, erectile dysfunction is often a sign of broader health problems that need attention. Fourth, early intervention is key. The longer erectile dysfunction persists, the more difficult it can be to treat as structural changes occur in the erectile tissue. Fifth, communication with your partner and with healthcare providers is essential. Shame and silence only make the problem worse. I want to emphasize something that often gets lost in discussions of erectile dysfunction. This is not a moral failing, it's not a weakness, and it's not something to be ashamed of. Erectile dysfunction is a medical condition with physiological causes, and it's incredibly common. Studies suggest that more than half of men over 40 experience some degree of erectile dysfunction, and the prevalence increases with age. You are not alone, you are not broken, and there is help available. The masculine ideal that says real men never have sexual problems is not only false, but actively harmful, preventing men from seeking the care they need and deserve. Your worth as a man, as a partner, as a person has nothing to do with your erectile function. What matters is your willingness to take care of your health, to communicate with your partner, and to seek solutions rather than suffering in silence. Let's also address the partner's perspective for a moment. If you're watching this and you're concerned about your partner, here's what you need to know. Erectile dysfunction can be deeply distressing for the man experiencing it, often triggering feelings of shame, inadequacy, and anxiety. The worst thing you can do is make him feel more pressure or more ashamed. The best thing you can do is create a safe, non-judgmental space for him to talk about what he's experiencing. Reassure him that you love him and desire him beyond just penetrative sex. Explore other forms of intimacy and pleasure together. Encourage him to seek medical help and offer to go with him if he wants support. Understand that this is a health issue, not a reflection of his attraction to you. Be patient with the process. Finding the right treatment can take time. Your support and understanding can make a tremendous difference in his willingness to address the problem and in the success of treatment. Now, let's talk about prevention. If you're watching this and you don't have erectile dysfunction yet, what can you do to keep it that way? The same lifestyle factors we've discussed are your best prevention strategy. Maintain a healthy weight, particularly avoiding abdominal obesity. Exercise regularly, combining both cardiovascular exercise and strength training. Eat a diet rich in whole foods, particularly fruits, vegetables, fish, and healthy fats, and low in processed foods and sugar. Don't smoke, and if you do, quit now. Smoking is one of the most damaging things you can do for erectile function. Limit alcohol to moderate amounts. Prioritize good sleep. Manage stress effectively. Maintain regular sexual activity. The use it or lose it principle really does apply. Have regular health checkups to catch and treat problems like high blood pressure, high cholesterol, and diabetes early. And pay attention to your body. If you notice changes, address them early rather than waiting until they become severe. There's one more aspect I want to touch on: the psychological and relational dimensions of sexuality. While we've focused heavily on the physical aspects of erectile function, it's crucial to acknowledge that sexuality is deeply influenced by your mental state and relationship dynamics. Stress, anxiety, depression, and relationship conflict can all contribute to erectile problems, and conversely, erectile problems can cause or worsen these psychological issues. If you're in a relationship where there's poor communication, unresolved conflicts, lack of emotional intimacy, or mismatched expectations around sex, these factors can manifest as erectile difficulties. Sometimes, the penis is simply telling you what the rest of your body already knows, that something isn't right in your emotional or relational world. This doesn't mean the physical factors aren't important. Rather, effective treatment often requires addressing both the physical and psychological dimensions. This is why working with a sex therapist or couples counselor, in addition to medical treatment, can be so valuable. These professionals can help you and your partner improve communication, reduce performance anxiety, explore new ways of experiencing pleasure and intimacy, address relationship issues that might be contributing to sexual problems, and develop realistic expectations about sex. Remember, great sex isn't just about firm erections. It's about connection, pleasure, communication, and mutual satisfaction. Let me share some common myths about erectile dysfunction that prevent men from seeking help. Myth number 1. Erectile dysfunction is a normal part of aging, and there's nothing you can do about it. While the risk of erectile dysfunction does increase with age, it's not an inevitable consequence of getting older. Many older men maintain good erectile function, and even when problems develop, they can often be effectively treated. Myth number 2. Erectile dysfunction is all in your head. While psychological factors can certainly contribute, the majority of erectile dysfunction cases in men over 40 have a significant physical component, particularly vascular problems. Myth number 3. If you have erectile dysfunction, it means you're not attracted to your partner anymore. Attraction and desire are separate from the physical mechanism of erection. You can be intensely attracted to someone and still experience erectile difficulties due to physical or psychological factors that have nothing to do with that attraction. Myth number 4. Medications like Viagra are the only solution. While these medications can be very effective, they're far from the only option, and for many men, lifestyle changes alone can be sufficient. Myth number 5. Once you start having erectile problems, it will only get worse. With appropriate intervention, many men see improvement or complete resolution of erectile dysfunction. The trajectory is not inevitably downward if you take action. As we come to the end of this video, I want to leave you with a few final thoughts. Your sexual health is an integral part of your overall health and well-being. Problems in this area deserve attention and care, just like any other health concern. The 5 signs we've discussed today: reduced firmness, decreased duration, changes in desire, presence of risk factors, and fewer morning erections are your body's way of communicating with you. Listen to what it's saying. Don't wait until the problem becomes severe or until it causes serious damage to your relationship or your self-esteem. Don't suffer in silence. The combination of lifestyle modification, medical treatment when appropriate, and psychological support when needed can be remarkably effective. You have more control over this than you might think, and there are more resources available to help you than ever before. Take the first step today, whether that's committing to a lifestyle change, scheduling a doctor's appointment, or simply opening up a conversation with your partner. And now, I want to hear from you. What is your biggest pain point right now regarding your sexual health? What worries you most or prevents you from living your intimacy to the fullest? Please share in the comments below. Your honesty might help someone else who's struggling with the same issue feel less alone. Let's create a community where men can talk openly about these issues without shame or judgment, where we can learn from each other's experiences, and where we can support each other in taking care of our health. Remember, seeking help isn't weakness, it's wisdom. Taking care of your sexual health isn't vanity, it's self-care. And talking about these issues isn't uncomfortable, it's courageous. Thank you for watching, and I look forward to reading your comments and continuing this important conversation. Tentar novamente ou claude pode cometer erros. Confira sempre as respostas. Soné 4.5